Also have with us Dr. PSV Rao, consultant surgeon of Manipal University with us. Thank you so much for joining us on the telecast. So what do you think when it comes to an incident like this, when we're seeing the preliminary investigation, we're seeing that the fire, when it broke out, the alarm did not go off, and then the cylinders were expired in 2020. In this case, when it comes to cases like this, who's to blame and who's responsible for this? And what do you think? What do you assess the situation that has happened?
Good afternoon, Ria, and to all your viewers.
All right, we are facing some connection issues of him, but we'll be back with him. When it comes to an incident like this, we're seeing where a fire broke out in Jhansi Medical College, and which led to a loss of 10 newborn babies, in which 7 have been identified so far and 3 will be identified. And we are also seeing that the family members are protesting outside, and they have gathered outside. A huge crowd has gathered outside the Jhansi Medical College, and they are demanding and urging and they're really angry about the lack of information being shared about the children. And when it comes to an investigation, so the preliminary investigation suggests that when the fire broke out, the fire alarm did not go off even after it broke out. And when it comes to the fire extinguishers, they expired in 2020. We have back with us Dr. PSV Rao. Dr. PSV Rao, this tragic incident took place. How do you think, how do you assess this situation that has happened, this incident that has taken place in the hospital?
Yeah, Ria, good afternoon, and good afternoon to all your viewers. This tragedy has happened in the past. These tragedies will continue to happen for the simple reason that the hospital administrations don't bother about the safety measures, and they should have regular fire drills where as if there is a fire, they run a drill. This is when they will know if their fire alarms are working, if their extinguishers are working, if their water, the water is available for the hose pipes of the fire engines if they come, and if the roads leading to the hospital are clear of obstructions. Otherwise, so often these hospitals are in crowded places, the fire engines are unable to reach there, or sometimes their telecommunication is down, so they are unable to inform the fire engine. These things need to be, drills need to be conducted on a regular basis by all hospitals. And many of the hospitals don't have external staircase. You can't use lift during the fire. You have to have external staircase to escape. And some of the hospitals which have external staircase, they have got all kinds of rubbish or other stuff in these staircases, which prevent you from using these staircases when there is a fire. So they have to check how their water hydrants are, if there is enough water pressure in it, if the fire alarms are working, if the extinguishers are functioning, and if the staff of the hospital knows exactly where what measures to take in the case of a fire and how to get out, and also how to put off the electric power if any short circuit leads to these kind of things. And remember, hospitals have also got inflammable gases. These cylinders also need to be checked, and the manifold to which these cylinders connect also have to be checked. These are the reasons why we have these fires, because no one checks these, and the hospital administration is fully responsible for it. Let's not politicize this thing. We have to catch the hospital administration responsible for not bothering about checking all these things. If the fire hydrant is not functioning, if the alarm didn't go off, and if these measures were not taken, the hospital administration is fully responsible for this. The security of the hospital is their responsibility. Security includes fire security, it includes various other disasters which could happen. And hospitals are the place where the maximum injuries occur to workers. If you take all industries and services, the highest incidence of injuries is in the hospital because of various reasons, including inflammable gases, including combustible materials around. So these things are definitely a responsibility of the hospital administration, and they should be taken to task.
Dr. PSV Rao, when we're talking about an incident like this, and this, as you rightly said, this is not something that happened, that is something new. It has happened in the past as well. When it comes to the investigation that a short circuit took place, or either the extinguishers were expired, or the fire alarm did not go off, and a fire like this, it takes almost 2 hours to douse. And now even the family members are alleging that the babies have been swabbed, and then they demand the DNA, that they demand that they should conduct on all of the babies, that so they can correctly identify whose baby is that. What does this incident say about the healthcare system and the state of it?
It is an extremely regrettable incident, and sadly, this keeps happening. If you remember, it was not very long ago that you had a hospital in Delhi which was dealing again with newborns, which had a fire. So many people died. What is the lessons we learned? We haven't. We have to get all hospitals to look into their security measures, into the fire safety measures. They have to have a drill on regular basis, and this will otherwise keep happening. And these are newborn babies. No wonder the public wants to know if whose baby it is. These babies can easily be switched, and in all the hurry-burry, they would have just run out with all those babies without being very sure which baby, unless they had number tags around their wrist to show their identity. So these are all issues that will now have to be faced for this tragic incident. My sympathies are with them, but for heaven's sake, I'm requesting all politicians to stop playing politics with this, and the administration of not only this hospital, for all hospitals, government, public, everything, there has to be a check as to if they are conducting these safety drills and they are taking the safety measures. Like I mentioned, especially the safe use of gases and the electric connections. Many of these places will have false ceiling with all kinds of electric wires, cables, pipes, tubings running around with it. So these are very prone to disasters if you are not going to take safety measures. And the electric contractor who
All
put
right,
up this
Dr.
cabling.
PSV Rao, thank you so much for joining us on the telecast and sharing those details.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.